All right, so welcome everyone to our December office hours. My name is Cristina Hernandez. I use she, her, ella pronouns. I'm with the Oregon Health Authority's Community Partner Outreach Program. I am one of the regional outreach coordinators that supports the Willamette Valley. So if we can move on to the next slide. Today, during this webinar, we're going to be going over some general OHP bridge updates. We're also going to be giving some updates about the OHP, the unwinding or the PHE unwinding process, and then some other updates about some new benefits that are launching in January, and then we'll have some open time for discussion. So with that, I will hand it off to my colleague, Sean, and take it away, Sean.
My name is Sean McNulty. I'm OHP Member Communications Coordinator, but the bridge section is going to be with Katie Waldo instead.
Yeah. Okay. Awesome. Thank you so much, Sean. Hi, everyone. My name is Katie Waldo. I use she, her pronouns, and I am the lead project manager for OHP Bridge. So for those of you who might be hearing about OHP Bridge for the first time today or less familiar with the program, OHP Bridge is a new benefit for adults with higher incomes in Oregon. So in order to qualify for this new benefit, you do have to have an income up to 200% of the federal poverty level, be between the ages of 19 and 64. So this is an adults only program. You cannot have access to another form of affordable health insurance, and you have to have an eligible immigration or citizenship status. And it's important to note that the benefit package itself is very similar to OHP Plus with just a few minor changes, mostly related to long-term services and supports and health-related social needs, so HRSN. It is a free coverage option, so there's no member costs such as copays or deductibles. We can go on to the next slide. So we know there's some confusion sometimes around the two programs that deliver this, but we do have two OHP Bridge programs. They deliver the same benefit package. So the first is OHP Bridge Basic Health Program, which is the program that will cover a majority of OHP Bridge members. It is managed exclusively by CCOs, and this is a federal requirement. So there's no option for open card on this program. We also have another program called OHP Bridge Basic Medicaid, and this was developed specifically for our American Indian and Alaskan Native members in order to preserve their right to choose between CCO and open card coverage. So that's the smaller program that will just cover those folks. So we do have three major populations we're aware of that are going to be moving on to OHP Bridge, and this is going to happen over the course of a couple of years. So the first population was individuals that were moving over from our Oregon Health Plan or Medicaid option. And these were folks that, for the most part, were on the temporary Medicaid expansion, which was implemented in order to ensure that we were able to continue coverage for individuals following the end of the public health emergency while we were standing up this OHP Bridge program. So when OHP Bridge went live on July 1st, these folks moved over. So we saw about 22,000 people come over from the temporary Medicaid expansion. We also have folks who were previously uninsured, so they didn't have access to healthcare coverage. And as of launch in July 1st, folks were able to apply for and begin to get coverage through this program. So we also have individuals coming over from that population. And lastly, we have folks who are moving over from our marketplace plan. So beginning in July 1, individuals who are on marketplace plans who fall between 138 and 200% of the federal poverty level would become eligible for Bridge. Now we expect this group to move over the slowest because there are ways for people to maintain their marketplace coverage if they would like to. So we're expecting that due to things like continuous eligibility and auto enrollment and things like that, that folks will be staying on this program for a little bit longer. And we'll talk about that here in a second. So as most of you are likely to know, we're now in open enrollment for the marketplace. And so this is when we are really expecting to see kind of like the first big group of people move over from these plans. So in expectation of this, we have launched a new communications campaign. So we've got new information available on the website that's listed here on the screen, some additional comms going out related to how people can do that transition, what it looks like, how they can stay on. We do recognize that there may be folks who want to stay on their marketplace plan for a little while. And while we can't guarantee that this is going to be possible for people, there are a couple of ways that they can increase their likelihood of getting to stay on that plan for longer. So if they have agreed to do auto enroll for the next plan year, and if they do not have to make any updates to their application. So as a reminder, folks who have experienced qualified changes do have to update their application. We are not encouraging people to not do that as a way to stay on that plan. But if someone is enrolled in auto enroll and they don't have to make any of those changes, then it is possible for them to stay on their plan for up to 2 more years. If somebody does have to make a change to their plan or an update to their application, they will be reevaluated for available programs, and they may have to move over to OHP Bridge if they are eligible. Oh yeah, Sean.
I think I might just want to weigh in on the point and
Yes.
directly state the kind of inverse of that is if somebody has been approved for OHP Bridge, like with other OHP programs, there's generally not the option to just voluntarily terminate OHP and return to the marketplace and have the marketplace let you back in. That voluntary termination doesn't count as a loss of coverage to open up special enrollment periods and things like that. So getting back to it is not something that the system generally is intended to offer.
Yeah, thank you very much for that clarification, Sean. That is actually a really good point to kind of mention with the eligibility criteria. So for the most part, OHP Bridge is based on whether you have access to another form of affordable health coverage, not whether or not you're enrolled. So we really do want people to keep that in mind, especially when they're considering disenrolling from the program. Similarly, if people are finding out that they're eligible for OHP Bridge and they are, the marketplace will not terminate coverage for you. The members will need to go over and terminate their coverage on their own. With that in mind, we do want people to be really careful and work with assisters in order to ensure that they are not accidentally creating gaps in their coverage. So people should really, folks should really be paying attention to what their effective coverage date is for OHP Bridge, which will be included in their notice, and terminate their marketplace plan accordingly to make sure that they have coverage as they move from one plan to the next. So just really want to point that out for individuals so they don't accidentally terminate their plan too early and end up with a coverage gap. We obviously don't want that for folks.
And another bit of news in response to some feedback from this group actually was that we got a suggestion to add some language to the eligibility notice about the need to return to the marketplace and terminate your plan. We don't have a date on when that's going to happen yet, but we did get confirmed that we have the capacity to do so, and we'll be doing so at some point in the future. So thank you for voicing that through this group. Yep.
Awesome. Okay, I think that's everything for my section, so I will pass it back to you, Sean.
The other thing we wanted to provide some information on was just reiterate the changes that happened on November 1st, which made more people eligible for both OHP Bridge and the health insurance marketplace with financial assistance. That expanded the number of groups that fall under the eligible immigration status definition that OHP Bridge inherits as well. So the main group that got added to that was the deferred action for childhood arrivals status, which you probably know as DACA better, or sometimes Dreamers, as well as other groups who have particularly applied for asylum or applied for a green card, which is what the first two mean. There's some other groups like family unity beneficiaries and other types of employment authorization that did not previously qualify that also became eligible. Just want to clarify that this change is relevant to OHP Bridge and the marketplace, not the other OHP programs, traditionally known as OHP Plus. Healthier Oregon continues to offer coverage regardless of immigration status to anyone who meets the income limits for OHP Plus. So this is just the two higher income categories, OHP Bridge and the marketplace. We also want to take a moment to note the uncertainty here. We are still waiting on final court decisions about this case. This change might be halted in certain states or undone after launching. You can track that lawsuit here. There was some action on that yesterday. There was a stay issued which to our understanding only applies to certain states where they're putting the change on hold in other states that have sued over this. We do not have any final guidance from CMS on how this affects Oregon, and we're looking to confirm our understanding before we put out further messaging. There was an update yesterday, but at least at the initial look we've had, it does not appear to affect Oregon. So we'll continue to provide information as up to date as we possibly have. This changed since yesterday when the slide was written, so we're providing the update verbally of what we know there, but we will continue to push that out as we have something more certain and do so through various partner channels such as the group site, email threads, things like that. We will continue to provide updates through this office hours as well as anything changes there. In the meantime, there's some resources you can use to help folks get through promote this to folks, as well as resources on how to enter the DACA status that changed in November. There's a new DACA checkbox that got added to the one system. If you need a video guide on how to enter that, you can look at those video and paper guide there. Otherwise, slide in order to get that submitted for this inclusion in this deck. Otherwise, today's question is about billing and whether or not how to bill for OHP clients. They bill DMAP is the Division of Medical Assistance Programs, which is a term some providers will know OpenCard or fee-for-service OHP as, or EOCCO is the acronym for Eastern Oregon Coordinated Care Organization. The question finishes out by asking what claims mailing address and payer ID should they use to submit claims to OHP Bridge. So we've been getting a lot of questions about Bridge billing lately. In general, it follows the same systems and rules as other OHP members, though we wanted to remind you that most OHP Bridge members are going to be on a CCO, and that's the primary source of where to get the information on this. There's the two programs we've got within OHP Bridge benefit level. You've got the OHP Bridge Basic Health Program that can only be administered by CCOs. For that one, you're always going to follow the CCO's specific instructions. Contact the CCO for their billing instructions specifically. OHP Bridge Basic Medicaid, on the other hand, offers American Indian Alaska Native members the option to be either OpenCard or CCO. For that one, if they're enrolled in the CCO, follow the same CCO billing rules. Otherwise, if they're an OpenCard member, you would build OpenCard like other OpenCard members. For payer ID, that ends up being ORDHS. For mailing address for claims, it's depends on the type of claim you're submitting. There's a list there we've got linked on this slide, though for most members, billing is done electronically. We would favor that option if you have access to MMIS. General advice, though, is to direct most of those questions to CCOs. If you have OpenCard billing questions, though, our provider services unit is very good at helping with any difficulties that you're having with billing. General questions, though, you can always direct to the OHP Bridge email we've got on screen here. I think we want to take a moment for questions on OHP Bridge if we have anyone who'd like to weigh in on that. If you want to put it in the chat or raise your hand, either way. Unless we're hearing anything else, we'll move along and have more time for questions at the end. So turning to the pandemic unwinding, or public health emergency unwinding, since I've got an acronym on screen. As a reminder, we had people keeping benefits during the pandemic that we then had to renew after the end of the pandemic. There was the initial plan for 10 months of renewals in staggered waves, though we had a delay that happened in order to make some system changes for one issue and to give other people more information on the notices. That resulted in an additional 4 months of waves being added that started in June and went through September. Those are kind of the delayed waves, or I'll be using the term final phase for those last 4 months of renewals later on in here. So the who's left in the final wave slide there are 3 groups in that final wave of renewals, which is the final 4 months. That is primarily the Oregon Supplemental Income Program Medical, or otherwise known as OSIP-M, which provides OHP coverage to people who are either legally blind, have a disability, or are over 65 or older who have limited income and financial resources. Disability there includes many people with Social Security disability insurance, though it's also many other types of disability and disability programs. So that term kind of refers to our age and disability based programs, otherwise known as non-modified adjusted gross income, non-MAGI programs. Those programs have different eligibility rules. Some of them are OSIP-M, but the OSIP-M members fall into this group in larger numbers and mean that this final group of renewals was very heavily over 65 or had disabilities. There are also some other folks in there, though. There was a group of people whose benefits were restored as part of a request to review automated renewal process for households versus individuals. So there's some just families in there who do not necessarily have disabilities or or over 65. And then there are also the other case members on households with one of the two other groups of members. Also want to just note that since we only restored benefits for people who failed a renewal process, we let the successful renewals go and didn't make them redo things. We are seeing an increased rate of terminations, kind of paralleling the restorations we did back when benefits were restored back in the fall. The benefit category reduction category in particular went down, and now we're seeing that increase more. So if you've been to these office hours before, you've probably seen our data slide here. This describes outcomes across the entire renewal process. So far, we are 98.7% complete with the entire pandemic unwinding, which is great to see, getting down to the end there, with 80.5% of renewals continuing benefits, which is a bit lower than previous months. We have also seen the benefit reduction category nearly triple, up to 2.4% of all renewal outcomes. That benefit reduction category is usually somebody going from full OHP benefits to Medicare savings programs only, or sometimes dental only benefits. That means they're retaining some form of medical benefit, but it wasn't the same one they had. There's also a group where benefits are ending entirely, which is about 17% of total outcomes so far. That decrease we're seeing in the renewal rates there on this slide since over the last few months does indicate that we have seen some different outcomes for the renewals that are part of this group. When we limit the data to just the change in renewal outcomes since June 5th, which is the final wave of renewals, we see there have been 123,000 renewals completed in that time, where about 60% of them are keeping benefits. 18% are having that benefit reduction experience where they're going from OHP to just a Medicare savings program. So that's becoming a very common experience now. And then we also see a slightly higher rate in their benefits ending entirely. So not quite 40% of benefits are reducing or ending in this final group compared to under 20% in previous levels. So there's some data differences there. OHA has been hearing concerns about that from members, partners, and whatnot, specifically about the older adults and especially members with disabilities losing benefits at higher rates. We've been hearing partners and whatnot expressing some feedback about the different rules there. We do want to just directly come out and say that the higher closure rates for older adults and people with disabilities are caused by those eligibility rules being significantly different. Once somebody turns 65 or starts qualifying for Medicare, which for someone with Social Security disability happens after 2 years of being enrolled in that program, the income limits generally decrease unless somebody qualifies for long-term services or employed persons with disabilities program. Those are the two categories that offer higher income limits than even the adult program. Otherwise, for a single older or disabled adult, the income limit might drop to in the $900 per month range, depending if you're looking at the 2024 or 2025 income, in comparison with $1,700 for adults without Medicare. So there's a significant difference in the income limit to be able to qualify for full OHP benefits there. When that happens, the turning 65 or qualifying for Medicare, financial resource limits also may start to apply, limiting a single member to only $2,000 in countable assets in order to qualify. So between that income limit being much lower and that financial resource limit starting to apply, we see many people losing benefits that were able to keep them during the pandemic otherwise. That kind of explains the difference in renewal rates there. A lot of the feedback has been focusing on the policy options around this. States are able to choose less restrictive income and financial resource limits, and 25 states plus DC have done so. Though, and Oregon itself has removed the resource limits for Medicare savings programs back in 2016. A lot of the feedback has been specifically comparing California's recent moves to fully equalize the income limits between the age and disability-based Medicaid programs and regular adult programs. We also saw California completely remove its financial resources limits in 2024 and have been getting feedback around that topic. Raising the income limits or affecting the resource limits would require legislative action and funding, though. ODHS and OHA are not opposed to policy changes, but we need the direction from the legislature to do so. We're continuing to look at California and explore options on how something like this could be implemented from Oregon, but it's fundamentally a legislative decision on there. Other things we're doing, though, within their current policy constraints is really trying to maximize renewal rates through every means we can. There's a special outreach effort happening where our state customer service staff are calling members after they receive the renewal reminder notices if they haven't renewed, to make sure they know what they do during the renewal process, as well as directly schedule the eligibility interview. Many of those are required for people with non-Magi benefits, so we're trying to help get those connections made. For members who have a case manager through their long-term services and supports, we're also using them to make those similar calls. We also intentionally spread all these renewals out after delaying them in order to give more time for people to respond to this process, as well as ensure our staff had the capacity in order to provide that extra support when doing outreach. There were also updates to the eligibility notices back in May, though we're continuing to strive to improve those, and as well as the application as well. So if you have feedback about notices, we're always looking forward to hearing that. We've got our feedback email down at the bottom of this email or this slide here, though again, if we would note that if you have concerns you want to direct to your local legislators, they would be a channel for any of the policy changes around funding. So back to how this affects your direct assistance to members. Whenever you have a client that's losing OHP that has Medicare, we want them to first review the information used to make the decision to make sure that was correct. Report changes if anything has changed, particularly income. Though I would also call out that if somebody has become their disability needs have advanced, for instance, and they now would benefit from help with daily tasks of living, which is the long-term care question in the application. Reviewing that question and screening them for long-term care benefits might help affect those income limits so they can be considered at higher levels than they would have without the request for long-term care. Similarly, members who are found over the resource limits may have options for redistributing their financial resources in order to remain eligible. If you have anyone who's interested in that, send them to talk to an eligibility worker. That we really want them to do that before making any financial decisions, so they're not making themselves ineligible accidentally or not qualifying for benefits when they could, or making sure their questions are answered about those options. After that decision has been made and you're pretty sure that person is correctly terminating from OHP under current rules, we want them to go consider their Medicare plan choices with professional help like yourselves. But though specifically for Medicare plan choice counseling, the senior health insurance benefits assistants, counselors, or Medicare agents are the best option to go through. Going to OregonHealthcare.gov/gethelp can be the tool to find them. That timeline is very similar to marketplace enrollment, but for Medicare, it's 63 days. Within that time frame, you can consider Medigap options as well as Medicare Advantage options outside of the normal enrollment windows. So even though Medicare open enrollment season just ended at the end of the 7th of December, we are still in the window for anyone losing OHP. They have that 63-day window after losing OHP where they can go weigh their Medicare options and still enroll. Getting them to do that so they get set up for other coverage in addition to their Medicare if they need it. That's one of the main things we want to make sure these folks connect to after losing OHP. Other important part is to make sure that they understand any benefits they are keeping if they're in that benefit reduction category, as what Medicare savings program they qualify for may influence their decisions on Medigap plans in particular. I've got a slide here explaining the different levels of Medicare savings program. There are roughly 2 levels, there are multiple programs within this whole category. The QMB program provides secondary coverage that pays your Medicare premiums and out-of-pocket costs in addition to the premiums. So that it does provide secondary Medicaid coverage. QMB benefits ended up being basically the same as what a Medigap plan would cover. So if you get the QMB, you do not necessarily need to go consider enrolling in other benefits. You have your Medigap coverage providing something similar to, or you have your QMB coverage providing something similar to a Medigap. You can still consider a Medicare Advantage plan, though. Medicare Advantage plans might cover additional services beyond what traditional Medicare covers. That is the reason people might choose those, though they also come with additional network limitations and prices for services may be different. Then the other level of Medicare Savings Program is Part B premiums only, which does not provide any coverage. It only pays their Part B premium, which is about $170 per month. That's fantastic. It's about a 10% take-home income increase for anyone who gets that, but it does not provide any coverage beyond their basic Medicare, though those funds might be able to be used buy a Medicap or a Medicare Advantage plan, we really want those folks going to connect to Sheba to get assistance about that. And then anyone who qualifies for any of our Medicare savings programs is automatically going to get enrolled in a Part D plan for free. All of that is also something to discuss with your Sheba counselor, hopefully. So, unless there are topics that have been, or questions that have been dropped in the chat about that topic, I'm going to move along to our return to normal renewal timelines. This is kind of the inverse of the unwinding. After most people have gone through it, we are in the process of returning to normal renewal timelines. Through September, all renewals had the extended timelines, though we are now past the first wave of the interim return to normal renewal response timelines. Renewal response is that initial period of time where you get to respond to the renewal request before we send you the termination letter. That went down to at least 30 days, though in practice closer to 45. Starting in December 2024, most rules will be back to normal for renewals. The exception being the response timeline for any requests for information that are generated. They're much rarer at the renewal stage itself, but after you send in information to us, if we request more information about it, until the end of February, we're still going to give folks 90 days on that. That is the main and only remaining extended time frame we're giving folks. Though there is a feature of the extended adverse action timelines, the closure notice timelines that we'd been giving in October and November. All of those dates line up at the end of February for when folks are closing if they're in those October or November waves. Okay, and then all of that is to say that once we get to March 2025, we'll be fully back to normal. A lot of that can be confusing, especially how it relates to the reply date versus renewal date. Those definitions change a bit as they go back from what they meant during the pandemic to what they mean in our normal world. The continued focus for members, though, is to respond before benefits actually close or during their 90-day reconsideration period after benefits end. That is always still going to be an option. So, of course, we want people to respond as soon as we can. That way they can potentially keep benefits and have as much time to react and seek other options if they need to. Though we do want to caution that due to continuous eligibility, most renewals are going to be occurring every 2 years. So there's not going to be that many renewals happening this year. There will be some, though. For instance, OHP Bridge renewals will still happen on a 1-year basis. If you want more information about this whole topic, we also have our updated interactive renewal timeline available in English that will be coming out in Spanish in the next 2 weeks. Here is a graphical representation, very similar to that interactive. This is the slide version, but this can show the specific dates for upcoming renewal waves. I'll leave this up on screen if you want to take a quick screenshot of it, but we will be distributing the slides after this. Otherwise, I'm going to move on along. So there are 2 benefits rolling out in January we wanted to share some information about and show you where the webinar is to get more information about this. We don't have our policy experts about these programs here with us today. I'm happy to take questions, but we may need to relay any complicated ones back. We really wanted to promote those webinars where you can learn more about these, though. First one is going to be the Young Adults with Special Healthcare Needs benefit that's rolling out on January 1st. So you may see the one system questions appearing apparently as early as the 22nd of this month. That is the updated timeline as of earlier today. Starting the first of the year, though, they would be eligible for the benefit to start, where up to 205% of the poverty level, they can adult who is 19 or 20 can qualify to continue their OHP benefits, or can qualify for OHP benefits up to that higher income limit, which matches the OHP Bridge Basic Medicaid income limit. That YSHN program, as the acronym is known, it's Young Adults with Special Healthcare Needs, but YSHN is how we refer to it internally. That provides the same benefit as children up to age 21 or pregnant women currently get, where they have expanded dental and vision benefits. Children also get the early preventative screening, diagnosis, and treatment benefit, which is the new term for OHP's expanded coverage for children, where we cover anything that's medically necessary for the child. As long as the doctor thinks it's medically necessary and medically appropriate, it should be covered. It's an expansion to our previous from our previous list of specific services that we'd cover. We get more information on that later in here as well. So if someone qualifies for the Weishan program, they get benefits up until age 26. In its first year, it's only going to be eligible for 19 and 20-year-olds, though. Once they become eligible, though, they keep that EPSDT benefit where they have we are less likely to deny less common services up to their 26th birthday. EPSD specifically means that we cover all those medically necessary and appropriate care, even services OHP does not cover. There are services like durable medical equipment, rare specialty care, things like that that OHP had not previously covered up until when this program launched in 2023. The youth are going to have full access to that up until 2026 as part of this. Then in future years, Oregon is going to consider expanding the initial age gate, currently 19 to 20 for 2025, up till 2025 as funding allows. If you're wanting to learn more about this, I highly recommend you go to these live and recorded trainings that our CPOP partners are putting on. The first one's coming up on Thursday, and then Thursday of next week, the 17th. Sorry, the camera is blocking that from me from seeing that. With the Spanish coming up later that same day at 3 o'clock. The other big launch coming up in January is the nutrition benefit, which is through our health-related social needs program. We've had the climate, outreach, engagement, housing benefits already go live, and then the last of those to launch is the nutrition benefit starting in January. That will include nutrition education, medically tailored meals for 6 months, funds to buy fruit and vegetables for 6 months, funds to buy groceries or hot meals for pregnant individuals, children, young adults in that Weishan category, and more. Though people will need to be eligible for the health-related social needs groups. Here's a quick list of eligibility groups. If you're interested, more explanation about each of these will be provided in that training. And then these are some of the benefits you're able to receive on that program if you're interested. All of this was really going to promote the webinars that they're coming up. Going to that provider training webpage and the Weishan page are good resources for this. Otherwise, there's a I believe I have the wrong dates on the slide. We'll correct those before we send them out, but there's another one coming up where they're going to be talking about nutrition next. Okay. If you're wanting to see changes to the paper application, we had promised last month that we were going to be hosting a more intensive feedback session at this group. I've had to delay that till January, where we'll have more draft language to share with y'all and get feedback on, but wanted to hold some time in this meeting to get feedback and hear any thoughts you have prepared for us, as well as some of the things we're planning for this. If you have feedback, please feel free to send it to me directly, though you can also reach out to the feedback email or through your regional outreach coordinator. So some of the things that are happening on that project, there are some race, ethnicity, language, and disability, known as REALD, and sexual orientation and gender identity changes, where we are going to be updating the paper application to match what is currently in the one system. We are also looking to make the questions referring to long-term services and support screenings easier and more representative of the various service types. Specifically, what you might consider like the lower level service types, like needing help with in-home care, tasks of daily living, as opposed to just nursing home care or institutionalization. We want to make that also representative of intellectual and developmental disability programs, which also fall under this, and just make sure people are understanding what they're applying for when they're answering that question. We're also going to need to integrate the young adults with special healthcare needs screening questions. Those will be initially added as a separate standalone page, but we'll want to get them added into the paper application as an appendix. There are also going to be questions added, adding a route to apply for contraceptive care or family planning benefits, allowing them to either apply for those services separately or as part of the paper application. So letting them know of the option to apply separately or not. We're also looking to make a bunch of changes that are making things clear to members. For instance, this is the application for all medical benefits, not just OHP. Trying to work on questions that are confusing for members. Folks have flagged the child support questions for us, as well as the naturalized and derived citizenship questions as well. So we're really looking at the areas that are sticking points for members where they don't necessarily understand the question or might perceive it as a barrier to applying. Some of the limitations of this project, though, are that we really want the one system and paper application to align. So we're trying to align things with the one system, though we have some capacity to also adjust the one system questions. Wording obviously needs to pass policy, legal, federal reviews. We're a government agency. Those processes exist. But the main caveat is that while we can change one system question wording, any changes to functionality are a lot less likely to be possible or feasible within this project. We're happy to hear about feedback for other things, for future ideas to work on, but part of this paper application update, at least in the short term, is probably just going to be mostly wording focused. That may include reordering things, though there's sometimes system limitations there, but the main constraint we have is we need to stay within what's called a work item 40-hour limit of work to the system. So also want to be hearing about partner specific needs, not just the member experience ones. Member experience is definitely the focus, but if you have specific things that are affecting your workflow and make you more efficient as a partner, we want to hear about those too. A lot of partners are favoring one applications and only use the paper as a backup these days. So if there's in either of those situations, you often end up entering paper application information into one and flipping back and forth between pages. If there are things like that you want us to work on and ideas you have to improve things, we want to hear about that too. Some ideas around that have come up is how to handle large families. Currently, the application only has 4 household member lines for dependents and has us attach loose paper or cut additional pages inserted for proofs. If separable printed forms for these would be worthwhile, we're happy to entertain ideas like that as well. So that's kind of some of the initial stuff we're working on that update to the paper application. We will bring that back as a topic for next month, since we didn't get to put as much time to it in this month as we were hoping. Though I would love to hear some ideas you have now, as well as any other questions that we had about the content today.
Thank you, Sean. And I'm not seeing any questions in the chat, but I think we can just hang out here in case anybody has questions. Feel free to unmute, or if you want to drop them in the chat, we'll be here for a few more minutes. Oh, and then I did forget to mention, I think there might have been a little bit of a typo for the young adults with special healthcare needs training that CPOP is doing for community partners next week. They're both on Tuesday. So Tuesday the 17th. I think there was one that said Thursday and then Tuesday, but it's Tuesday the 17th.
Yep, sure. We'll get that changed before we send these out.
Okay.
Apologies for the error.
And I can try to pull the links for those 2 trainings and I'll drop them in the chat for everyone.
Any questions, thoughts on the paper application? Would love to hear.
I see there's a question in the chat, Sean, about if there will be additional training dates for those that can't attend on Tuesday.
So it'll be recorded. It'll be posted on group site. If you're not able to join on Tuesday, so it will be recorded. Angelica, what part of the state are you in? I think you might be, I'm trying to remember.
Hey, I'm in Tillamook. It's the English training is at the same time as our CPOP collaborative.
Oh, okay. Yeah, so it'll be recorded, but if you want to join the Spanish one, because it'll be at 3. I'm not sure.
Okay.
Okay.
Yeah, thank you.
Mhm.
Sorry, I see we've got another question regarding someone who had a community member who applied to OHP on November 7th, but they have yet to hear back, and whether or not OHP lets customers know when they've been denied.
Yes, they should be receiving a denial notice after or an eligibility notice after any outcome or decision has been made, whether or not that's them needing more information to make a decision, or in any case, you should be receiving a notice from us. The max turnaround timeline for us is up to 45 days. So that's still within our normal timelines, though if you have any level of medical urgency to it, reaching out to the community partner access team or just the customer service options can give you the status on that and potentially help you expedite it to get that back sooner. So 45 days would put us closer to the end of the month, would be a point at which it is overdue and definitely concerning that it's taken that long. Any other questions? Or feel free to suggest other topics for us to address down the road. Really would love the space to be interactive and helpful to y'all and be a way to get policy updates from various teams that yes, there are some. Oh, there's a question in the chat about where we can get HRSN training. There are some links we had in there, but specifically towards the HRSN provider training is probably what you're looking for if you're looking for a very detailed one of that version of that. Let me pull some links up real quickly and we'll drop them in the chat for you. So this page, first link is going to be the overall HRSN page. This has all of the resources for all the various programs. There are specific links on the right side of the page under resources that will take you to climate supports, housing supports, as well as member journeys, FAQs, and whatnot. I believe those pages have the trainings linked under them. Let me confirm that for sure, though.
And then I would also encourage you to reach out to, I think in that same page, there's a link to the different CCOs, because if it's a CCO member, each CCO might have a slightly different way in like how they're handling their application process for that. So I would say reach out to the local CCOs. A lot of them are doing, I know some of the ones in kind of the area that I support are doing sort of these like 101, HRSN 101 the provider trainings and helping people get a little bit more information that way. So I would say, reach out to the CCO2, your local CCO2 to see about what the process is in your region. Any other questions?
And I'm also putting the provider training page link in here.
Thank you.
And to clarify, with the HRSN provider, partners can become providers, especially of the outreach and enrollment benefit themselves. That benefit means helping people access HRSN. That's something you can get enrolled with OHP to be able to bill for your time helping members with. So that provider term within that doesn't necessarily mean you need to be a healthcare provider of other services. HRSN provider just means you're working intensely with those benefits, I think is. So don't let that term dissuade you from taking the provider level training. Any other questions from folks? Otherwise, we can end early and return some of your time, I think. Well, thank you all very much. We'll be meeting again in January. We'll see you again in the new year.
Thanks, everyone.
Bye, everyone. Thank you.